Red flags are being raised over the Ford government's plan to help clear the massive surgical backlog by allowing private clinics to conduct OHIP-covered surgeries. The Ontario Health Coalition says it has evidence that patients are already being exploited.
It should not be like going to a car mechanic when you go into your doctor's office where you're told that there are a range of things that you need and the patient has no idea how to measure the veracity of these claims.
The Ontario Health Coalition is out with a list of 20 patients who claim they were pressured or manipulated into paying more for medically needed surgeries and diagnostics. In one case, a woman from Newmarket needed heart surgery. She had trouble getting a timely MRI appointment and eventually ended up at a private clinic.
I had an MRI on January 12, and I had to pay $2,000 with my credit card for the MRI.
Other patients claim they were told they needed testing that they now know was unnecessary and that they were upsold on recovery rooms. In 2019, a woman from Lindsay, Ontario paid $5,300 for cataract surgery and says she was never told that she had the option to have OHIP-covered surgery with lenses and was told that her alternative to paying was an invasive surgery in the hospital with a 2-year wait. The Ontario Health Coalition says all of these examples are in violation of the Canada Health Act, and the Ford government has failed to crack down.
It has all kinds of different powers that they could use to stop this kind of practice and has not done so far. The question we have is why would we believe that they intend to do it now?
Bill 60 is meant to reduce surgical wait times by allowing more private clinics to open and conduct OHIP-covered surgeries like knee and hip replacements. It will come with several safeguards to ensure patients will not be paying out of pocket. And today, the Premier once again defended the healthcare plan.
When our neurosurgeons get a day and a half in the operating room, and they're saying they have more capacity for 5.5 days, absolutely. If there's opportunities to have a facility right beside a hospital or down the street from a hospital, and again, it will be paid through your OHIP card, not your credit card, I encourage it.
And all of this made for a fiery exchange at today's question period.
This is already happening in private clinics, and the government is working to expand it. What does the Premier have to say to these patients?
The new legislation is remedying a problem that has existed in public hospitals as well as clinics, and it is making sure that these things are posted so that people cannot be upcharged.
The supplementary question.
So Premier, just gouging patients, but more transparently. That's kind of what I got from that answer.
Now, the Ontario Health Coalition says right now there are underused operating rooms in almost every hospital across the province. And instead of turning to private clinics, the government should be properly funding these hospitals so they can fully ramp up surgeries.